This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, well, welcome everybody who's here. Happy Friday evening. This medical minute is about a recent study I thought was pretty interesting. It was a study looking at ketamine for seizures. So we use ketamine for all sorts of things, and there's been some literature that ketamine can be helpful for seizures, theoretically based on like NMDA properties that, there's receptors in the brain where ketamine could be helpful, but there haven't been a lot of good studies looking at it. So this was an interesting one that actually took a EMS system in Florida where they had a protocol for a long time, that just gave midazolam for seizures. And then they switched their protocol that if after midazolam, patients were still having seizures, they would give ketamine, a fairly large dose of ketamine, 100 milligram IV dose of ketamine. So kind of what we would use almost for a procedural sedation dose. And they compared kind of the percentage of patients who stopped seizing before they got to the emergency department on whether they got just the midazolam, the Versed, or whether they got Versed and then ketamine. And what the study showed was that with just the midazolam, about 82% of the patients stopped seizing by the time they got to the emergency department. But when they added the ketamine to patients that were still seizing, it was almost 95%, like 94.4% of patients stopped seizing before they got to the emergency department. And you might say, wow, 100 milligrams of ketamine, were these patients all sedated, needing to get intubated? Only 1% of patients, one patient needed to get intubated in the ketamine group, and that was the same as the Versed group, and that patient actually got 400 milligrams IM of ketamine, so a pretty big IM dose. So overall, it seems like it was very effective. It wasn't done in the emergency department. It's not a definitive study. It was kind of a before and after design. But I think there is definitely some promise there for it. If someone's still having seizures after kind of initial medications, we might see ketamine potentially. If you've got someone who really won't stop seizing with your regular medications, ketamine's potentially something to try. Any questions or comments? Thanks, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.